All right, y'all, now we're gonna do our focus on our CPR with babies, infants, anywhere from birth to 1 year, okay? So now with this, we're gonna do the same thing. We're gonna make sure we're in a safe environment, okay? Our patient's in a safe environment. Second, we're gonna check if our patient's responsive. Our patient here, infant, is not responsive. So now we're gonna shout for 911. So someone call 911, okay? Or yourself call 911 or get someone to call 911. Now we're gonna check if our patient is breathing. So our patient is obviously not breathing. Okay, so now we're gonna start our CPR compressions. For this placement, you're gonna have 2 fingers. You're gonna place them in the center of the chest. For this, you're gonna do 30 compressions for 15 to 18 seconds. You're gonna make sure that you do not do the compressions more than 1.5 inches. So now we start our compressions. Remember, 30 compressions. All right, and so now we're gonna start our breathing. So we're gonna get mouth to mouth. Make sure since this is an infant, your mouth is going to be covering the infant's mouth and nose. So now here we're gonna go get breaths. Remember, we're still giving our 2 breaths in 10 seconds. And now back to compressions. Remember, 2 fingers placement of the chest line, no greater than an inch, 1.5 inches. 30 compressions, 15 to 18 seconds. All right, so now y'all have learned how to do adult CPR as well with infant CPR, and you've also learned how to use an AED if you need to. Remember, a quick recap, make sure that you check your surrounding, your safe environment. 2, check if your patient is responsive. 3, call 911, shout for 911. 4, check for breathing, and then start CPR compressions, all right? Remember, these compressions has to be 30 compressions, and then you're gonna also do the compressions for 2 to 2, no greater than 2 inches for the adult compressions. And then for infant compressions, remember, you're gonna do 2 fingers, midline chest line right here, and you're gonna make sure it's no greater than 1.5 inches, okay? And you're gonna also remember during these compressions, you're gonna make sure that they recoil back. Alrighty, thank you. And now y'all are CPR certified.